Good evening, everybody. You're watching the Central Optometry Show. Today's topic is going to be a very interesting topic, and it's going to be interesting to everybody from young adults to the older population. As you know from our previous shows, we are a full-service optometry eye clinic, and we provide an extensive list of services for our patients, ranging from comprehensive eye examinations, contact lens fitting and evaluations, also pediatric care, vision screenings, LASIK consultations, and such other things. I also wanted to mention that we have a lab in site, as you know, where we make glasses in no time. The turnaround time is very fast. We have all the top high-end brands at very affordable prices, and we can provide glasses for everybody for every type of budget. Here at the clinic, we also see a lot of dry eye patients, and we are a specialty dry eye clinic. So today's show is going to be about dry eye, and I'm going to present a lot of information in this short segment. So if you have any questions, please feel free to email me at drsirunyan@gmail.com, or you can give us a call at our office during our business hours, 818-240-7772. You may also visit our website, dryeyestreatment.com, and you can read about dry eye. There is a lot of information on the website. If you give us a call, we can go ahead and address any type of concerns and extra questions that you may have. Սիրելի հեռուստադիտողներ, բարի երեկո, այսօրվա շոուի ընթացքում պիտի խոսենք աչքի չորության մասին եւ ինչպես կարող ենք ախտորոշել եւ տարբեր մեթոդներով դադարեցնել սիմպտոմները. We will return shortly. Thank you.
Central Optometry կենտրոնն ու Board Certified ակնաբուժ Սոնա Սիրունյանը առաջարկում են ակնաբուժական ծառայությունների լայն ցանկ, այդ թվում աչքի ընդհանուր քննություն, ակնային հիվանդությունների ախտորոշում եւ բուժում։ Աչքերի չորության բուժման համար այստեղ կիրառվում է շրջանում միակը հանդիսացող Ep.4 բարձրորակ սարքավորում, մանկական ակնաբուժական ծառայություններ եւ այլն։ Central Optometry-ն առաջարկում է նաեւ contact lens-երի եւ հայտնի պիտակների օպտիկական ակնոցների լայն ընտրանի։ Central Optometry.
Okay, welcome back, and let me go ahead and explain that there are two major types of dry eye. There's aqueous deficiency and evaporative dry eye. In aqueous deficiency, the patient is actually lacking the tears or the production of tears. This can happen indirectly through the patient having evaporative dry eye, or actually through autoimmune conditions where the lacrimal gland is attacked, and so it is unable to produce the tears, and this causes dryness in the patient and an uncomfortable feeling of the eyes. The second condition, which is majority of the patients, is called evaporative dry eye. Let me also say that aqueous deficiency occurs in about 15% of the dry eye population. Evaporative dry eye occurs when the protective layer of the tears is missing, the oil layer. And when the protective layer of the tears is missing, the aqueous or the water portion of the tears evaporates very quickly, and thus causes dryness and different types of symptoms. Some of the symptoms that it causes is irritation, a burning feeling like there's sand in the eyes, very sensitivity to light, also vision could be blurred, and itchy, and just a general uncomfortable feeling for the patient. One other interesting symptom that I would like to mention is a tearing of the eye. Let's go ahead and take a look at a picture. And here we see that there's tears coming out of the patient's eyes. And the patients who usually come to my office complain that their eyes tear, especially the older population. And they don't quite grasp the topic that the idea that their eyes could actually be dry, and especially when I say your eyes are dry, they're in shock. Why would my eyes be dry? My eyes are tearing. Well, what happens is when your eyes dry out, the lacrimal gland actually tears reflexively. It's called reflexive tearing. And so it produces an extra amount of tears to actually coat the eye and keep the eyes moist. Let's go ahead and take a very quick look at a short clip, okay?
Are your eyes bothering you? Not just the occasional dryness or redness, but regular discomfort and irritation that can get in the way of living your normal life? You may have meibomian gland dysfunction or evaporative dry eye. Your tears are made up of 3 layers: the mucin layer that adheres to the eye, the aqueous or water layer, and the lipid or oil layer, which lubricates and prevents evaporation. The lipid layer is created by meibomian glands in the eyelid. When you blink, pressure is put on the glands and lipids are released. New technology allows your doctor to view the tear film, seen as a dynamic color pattern on the surface of the eye. The LipiView takes detailed images of your tear film during a non-invasive in-office exam. Until now, much of the focus of dry eye treatment has been on supplementing the tear film with the use of drops and ointments. However, 65% of patients with dry eye symptoms actually suffer from evaporative dry eye, a real disease that could worsen if left untreated. Evaporative dry eye disease is most often caused by meibomian gland dysfunction, a blockage or obstruction in the meibomian glands, which can lead to a lipid deficiency in the tears. This blockage causes symptoms such as watering, gritty feeling in eyes, and itching. If left untreated, blocked glands can stop functioning altogether.
Okay, so as we saw in the video, as the meibomian glands fail to produce this oil, which is a very important part of the tears, the aqueous layer starts to evaporate. Once the aqueous layer evaporates, then your corneal nerves are actually exposed to the air. And since the corneal nerves are exposed to the air, they react and sensory, they react and they're very sensory. So as soon as the corneal nerves react and say, oh, the eyes are dry, they're now not being protected, the nerves, it goes to your eye as pain. And so patients can actually complain of the dry eye symptoms as I listed before, the dryness, the greediness, the sensitivity to any type of air, wind, dust, even air conditioning, and as well as sunlight. And in severe cases, it does blur the vision. There are different stages for the evaporative dry eye. In the beginning stages, patients actually don't feel a lot of symptoms. It's up to the doctor to let the patient know that they actually see signs of evaporative dry eye, and we actually evaluate the patient through an extensive types of tests. Let me go ahead and mention a few of these tests. So we actually check to see how quickly the tears evaporate off the cornea through a tear breakup test. We then actually test to see how much tears your eye is able to produce, basal, so during normal times, and reflexive, during when the eye is stimulated to produce the tears, and we measure that. We also measure to see how often you blink, if you blink incompletely or not, because research has shown that majority of dry eye patients actually tend to have an incomplete blink. And this in turn causes the condition to get worse, because if you're not blinking completely, you're not stimulating the meibomian glands, and so they're not producing the adequate amount of oil. The other thing that we check is called lag ophthalmos, if you actually close your eyes completely. And this is imperative too, because at nights when patients sleep and they are dry eye sufferers, they tend to not close their eyes completely. So there's a small slit of opening that may not be visible to the naked eye, but we are able to measure that. And if the patient is sleeping 8 hours or 6 hours or so, and the eyes are not completely closed, during this time, the aqueous or the tears actually evaporate. And so the patient wakes up, and upon opening their eyes, there is a burning sensation and pain associated with the opening of the eyes. And this is due to the fact that now, over the period of 4 hours or 6 hours or 8 hours, you've created a dry spot on the cornea. And as the lids rub on the dry spot, you get the sensation of pain. Let's go ahead and take a look at some pictures. Now I'm going to show you the different stages of meibomian gland dysfunction. So in this picture, unfortunately, some of my information is blocking, but if you could see, there are the excretions of the oils. This is actually about 2+ severity. In this case, the oils are actually coming out. They're solidified a little bit. Let's take a look at the next picture. And in this picture, you could see that it's quite severe. The patient here is probably a severity of a 3+, about moderate to severe dry eye. And in these patients, the glands are pretty clogged up. The oil is very difficult for the oil to come out. And if we actually push on the lids with quite a bit of force, the oil will come out in this cheesy, whitish, cottage cheesy, stringy formation. And this tells us that the oil is quite backed up. The meibomian glands are pretty inflamed. And other than home therapy, other types of therapy needs to be considered. Once the patient is given the treatment plan, and the treatment plan is actually very easy, but unfortunately, because in the early stages, patients really don't feel any symptoms, they just don't feel like, listening to the doctor or being too compliant with the treatment. The number one treatment for evaporative dry eye is heat and massage. Also, we do recommend some eye drops that will help to supplement the tears. But the ultimate therapy is to apply heat to the lids and to massage the lids to continue to stimulate the meibomian glands so the production of the oil can continue. And if there is any blockage, hopefully the heat can melt the hardened oils and the massage can soften it up and actually open up the glands. If treatment is not done, and if the patient gets to the 3+ or 4+, severe stages of dry eye, the glands can be severely blocked. If we take a look at this next picture, this actually, so this picture actually shows how to massage the lids. You can either massage it with a Q-tip where you actually locally push on the bottom of the glands after you've applied the heat, or let's take a look at the next picture, or you can actually massage it with your fingers. Both work well. Some patients prefer the finger because they say that using the Q-tip actually hurts. Some patients prefer the Q-tip because the Q-tip is actually pushing on each gland locally, so it's more effective than just diffusely pushing on the lid. So let's go to the next picture, and hopefully it's the picture that we want. Yes, this picture actually shows a severe blockage of one of the meibomian glands. When this happens, this is actually called a hordeolum or a sty. It's quite a lot of blockage, and at this point the eye looks pretty warm. It's probably painful. The eye looks hot. It's the same treatment. You have to put warm compress on it to melt the oils for about 7 to 10 days, and the condition should resolve. However, if the condition does not resolve or these styes continue to occur, it could turn into a chalazion. So if the condition doesn't resolve and the oils do not subside, what happens is they turn into a little hard lump. At this point, the lump is painless. There's no pain associated with it, but the oils and the debris have hardened. And there are other alternative treatments for it. Some of them include steroid injections, and some actually include surgical incisions where they go ahead and surgically remove it. Dry eye, this type of dry eye occurs in about 87% of patients, this evaporative dry eye. And it occurs in the older population due to increase in hormones, changes in the hormones, especially in women over 40 as they go through menopause. And, it's a natural process that occurs if it occurs at an older age. It doesn't occur overnight. It takes years for this to develop. But once it develops, it actually is a lifelong condition because the meibomian glands become inflamed. And so your bacteria and your natural flora of bacteria that you have on the eye start to attack your meibomian glands. And so, the bacteria is now, instead of protecting you, is attacking you. So the purpose of the treatment is not to eradicate the bacteria, because you have to have a certain amount of bacteria on the surface of the eye. But instead, it's to maintain the normal level of bacteria. So the treatments are to help maintain the normal level and to decrease the symptoms. Unfortunately, as I said before, you cannot cure this condition. Now, in the older population, this occurs because of age. When I see this in the younger population, the 20s and the 30-year-olds, this is when it's very sad, because at this point, there is nothing physiologically going on with the patient's eyes that should cause this condition to occur. But in the 20 and 30-year-olds, it occurs quite a bit, actually. Most of the patients that have this condition tend to work on the computer long hours, are the patients who study quite a bit. And besides those patients, actually, this is in the young population, it's something that you create. This is a condition that you're creating on yourself by excessive texting, using the Facebook, using computers for a long period of time. It's actually a lifestyle that causes this condition. So also it's very difficult to treat these patients because you're asking the patient to completely change their lifestyle, which is very difficult to do. Some of the patients who come into the office, they're kind of in shock because they don't understand that they could possibly have this condition. They come in saying that they have trouble focusing. They'll say, doctor, I see very well, I see very clearly, but I can't focus. Do you understand what I'm saying? And I nod my head and I say, of course I understand. This is a very common symptom that patients come in with. And then I can explain to them what they're having, what the symptoms are, and what the condition is. And some of these patients are already at this third and fourth stage, because now when they're saying that they can see clearly, but they're unable to focus sometimes, this is already affecting their daily life. They can not focus when they're driving. They're having focusing issues when they're even having dinner, watching TV, so it's affecting their daily activities. So a lot of these patients are recommended to give a break between using the computer. So if you're going to be using the computer for about 8 hours, let's say you give a break every 2 hours for about 15 minutes, and you have to look at something far away, further than 20 feet. If you're going to give a break and text or check Facebook or surf the net, that's not considering giving a break to your eyes. So once you give a break to your eyes, your natural blink rate will resume. Because what happens is, if you're studying too much, or if you're using the computer for 8+ hours and you're actually working for like 4 or 5 hours at a time, you're actually doing what we call a concentrated task. When you're doing these tasks, your blink rate decreases. And if you're doing this for many years, this doesn't happen overnight, but over the course of many years, you're actually you're training your eyes to blink less. You're training your eyes to stimulate your meibomian glands less and less. And if you don't blink completely, you're actually not stimulating the glands. So the oils are getting backed up. And so the oils are getting unhealthy. They're having debris and dirt in them. And so the amount of oil that's coming out is actually less unhealthy oil. And if you're blinking very, very seldomly, as we see in patients who have this condition, you're actually carrying on dirty oil or old oil, and that's coating the eye. If the old oil or the dirty oil is coating the eye, then the light that's going through the surface of the cornea is actually not being refracted correctly, and so you're having blurry vision. Most of these patients actually complain of these symptoms at the end of the day, because in the beginning, in the morning, you've actually had a good night's sleep and you're fresh, but throughout the end of the day, you're having symptoms of the dryness. Let's go ahead and watch another short video, and we'll go ahead and discuss it afterwards. Thank you.
The meibomian glands produce the lipid layer of the tear film in the eye. The lipid layer protects the eye's natural moisture, or aqueous, and allows the eyelid to glide safely over the eye. Cells on the inner wall of the meibomian gland acini produce oil. In a normal eye, when you blink, the lids touch and pressure is applied to meibomian glands, causing them to express small amounts of this oil. The upper lid then pulls the oil upward over the eye as the lid opens. When the gland becomes blocked, there is not enough oil to coat the tear film, and the aqueous evaporates rapidly. Without adequate lubrication between them, the eyelids and cornea can abrade each other, causing inflammation and cell damage to the lid wiper and cornea. Simply removing meibomian gland blockage isn't enough. The acini may not start producing oil again until the accumulation of dead cells within them are flushed. Doctors now have the ability to assess meibomian gland dysfunction with a meibomian gland evaluator, or MGE. The MGE exerts pressure consistent with a deliberate blink, allowing evaluation of gland secretions in 3 regions of the eyelid. Using the MGE, secretions for 5 glands in each region are scored on a scale of 0 to 3. 0, no secretions. 1, inspissated secretions. 2, cloudy secretions. Or 3, the normal state of clear secretions. The LipiFlow system uses heat and a 12-minute pressure profile to remove blockages in the meibomian glands. By heating the glands from the inside, blockages are liquefied. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland. The LipiFlow activator insulates on its inner surface and vaults the cornea to protect it from heat. Therapeutic heat of 42.5 degrees is accurately controlled and directed outward, away from the cornea to the lids. The device never lets the cornea exceed a safe 39.5 degrees, unlike chemical heat packs that have been shown to overheat. Also, unlike manual lid massage. LipiFlow safely applies pressure to the lids, not to the cornea or the globe.
Okay, so as you guys could see in the clip, meibomian gland is actually a condition, evaporative dry eye is actually a condition of the meibomian glands as it was described, and it was actually showed you a great picture of how the tear film is separated and the sections of the tear film. Now, once the patient becomes very severe and they're actually non-compliant with the home remedies and they don't do it over time, the home remedies tend not to work as well. We have to actually think of other means. One of the means is this LipiFlow thermal pulsation system, which is the only FDA-approved system to help with evaporative dry eye. It actually gives direct heat to the glands versus when you put a warm compress, you're doing indirect heat. With the direct heat, it's more effectively softening up the oils, and the way that the activators are put on the eye. Let's take a look at this picture here. It's going to show you how the activator is put on the patient. It's actually very comfortable. It's a 12-minute procedure. Patient is laying down. You put the activators on. They feel the heat, and it's a very, very effective form of massage. It massages the glands, and it actually opens up about 90% of these meibomian glands. It's about 87% effective, and the patients can have positive results if they are true dry eye sufferers. I'm the only one in Glendale to have this machine and to offer it to my dry eye patients. I've actually had very good results with many of my patients. I was going to show you another clip but I don't have time. But I would like for you to watch a short clip of one of my patients, and they're giving a testimonial of how their eyes feel after the treatment. So let's watch this clip now. Could you tell me a little bit about how your eyes feel now compared to a month ago?
There's a huge difference. There's a big difference. I'm a mom again. That was my main concern, and I can actually be with my kids and do all the activities that I want to do. I can drive. I can do a lot of things.
Do you find yourself using the eye drops, the Restasis, a little bit less, or is it still the same?
Not as much as I used to. No.
Okay, thank you very much.
Thank you.
Okay, guys, as you saw, there was a patient of mine who had the LipiFlow treatment done, and I had seen her 1 month after the treatment. Actually, one of the patients who had the best results in my office. I would love to share a lot more information with you, but unfortunately, I don't have any more time. The time has run out. But go ahead and feel free to email me, drcirunian@gmail.com. Visit the website. The website has an extensive amount of information about dry eye. It has some more videos, dryeyeystreatment.com. Also, give us a call if you feel like you have dry eye, or if you feel like you need to talk or make an appointment to see me. I would love to see you and evaluate your eyes. 818-240-7772. Majority of meibomian gland dysfunction that causes this evaporative dry eye is actually seeing the right doctor who can evaluate you and give you an immaculate amount of patient education, so you understand what's going on with your eye. If you understand what's going on, you will be able to take care of your eyes and follow with the treatments, and you will see results. Just by doing the home remedies, I do have a lot of patients who are just doing the home remedies that I recommend, and if they do them correctly, they actually see results. Thank you very much, and we'll see you next week. Have a great night. Bye-bye.